How are ya? I hope you're having a great day. Well, I made it through all my dental work. That was rough, but I got through it. Thanksgiving's right around the corner. Got a lot of housework to get done, but it's going to be worth it and so much fun. Chronic pain affects between 50 and 116 million American adults. That number is higher than those affected by heart disease, cancer, and diabetes combined. Cost of chronic pain by those who suffer is between $560 to $635 billion annually through lost productivity and medical expenses. That's staggering. In addition, many patients become tolerant of conventional medical treatments or suffer adverse side effects, like from non-steroidal anti-inflammatory agents or opiates that are highly addictive. Since 2003, CBD has been studied to determine its efficacy in reducing pain when traditional treatments fail. First of all, what concerns me is that a cannabis testing company called CannaSafe found that of the 20 most popular CBD products, only 3 contained what was on the label. 2 of the products didn't have any CBD in it, and about half of the CBD products had less than 20% of the CBD claimed on the label. In addition, toxic gases and solvents were reported in the product. Because of this, there's an urgent need to regulate CBD products. The 2018 Farm Bill, through Congress, loosened the restrictions pertaining to growth, cultivation, and distribution of hemp by permitting all 50 states to implement licensing programs. The product must not contain more than 0.3% of THC, including those containing CBD. States can implement stricter requirements, however. The FDA does state that they regulate cannabis and cannabis-derived compounds under the FD&C Act. Currently, though, only one CBD-containing drug is authorized for use as a drug, called Epidiolex. There are 3 hemp products that are authorized for consumer use. But many states have stepped in and implemented further requirements pertaining to the labeling of CBD-containing products. For example, in Indiana, where I live, CBD-containing products with low THC hemp extract can be distributed if the product has been approved by the FDA or DEA as a prescription or over-the-counter drug, or meets the requirement of the FD&C Act. But those products must be labeled with a barcode with respect to the manufacturing of the low THC hemp extract, including cosmetics. Many studies have concluded that CBD is safe and effective for those with fibromyalgia. CBD is devoid of the psychoactive effects associated with THC. In 2020, one study stated there's still a lack of regulation for commercial products. As you can see on this video, Cannabidiol is well tolerated and effective for intractable pain. It improves quality of life and sleep. However, long-term studies are lacking, and there's evidence that it causes teratogenicity effect in a developing fetus, which means it potentially can cause birth defects. In February of 2023, a large study of 200 patients with fibromyalgia will be completed. Patients will be looked after for improvements in their condition and for any potential side effects. I look forward to reading that one. And of course, I'll share it with you all. It appears that CBD oil may alleviate symptoms of fibromyalgia for some people, according to a 2020 review of the literature. It may relieve pain, improve sleep, and reduce refractory pain. It may also help with IBS and migraine. In a 2019 study, people with fibromyalgia who took CBD in combination with THC, a drug called Cannabidiol, reported a 30% decrease in pain scores compared to those who took a placebo. But it's unclear if the effects were due to the THC added or the CBD. A synthetic cannabinoid called nabilone was reviewed in 2016, and fibro patients tolerated it poorly and had no significant benefits to their fibromyalgia issues. However, a 2020 review found it to be one of the most promising drugs in pain medicine. I don't like the sound of synthetic. Do you? The studies are slim since getting high quality CBD or medical cannabis is difficult to find due to the lack of regulation. You can buy cannabidiol as an oil, tablet, or cream. Since this isn't regulated, doctors are not yet able to confirm a safe dosage for each use. Epidiolex, the approved cannabis-derived product by prescription, is a form of CBD oil. The starting dosage is 2.5 milligrams per kilogram of body weight, with a total dose of 5 milligrams per kilogram each day. After a week, people may increase the dosage to 5 milligrams per kilogram twice daily for a total of 10 milligrams per kilogram each day. A CBD product may be in the form of a CBD oil solution, CBD capsule, a tablet that's placed under the tongue, or a nasal spray. In studies, various different dosages have been used, so I'm not going to cover that at this time. I need to do more research on that. Most common side effects are dizziness, nausea, dry mouth, diarrhea, changes in mood such as irritability or agitation, and drowsiness. It is important to talk to your medical care professional. Mixing CBD with depressants or alcohol can result in injuries. There can be interactions between other medications or even liver failure. So follow directions and talk to your doctor. Everyone knows about the opioid epidemic. But now that I'm not working outside the home, I don't hear as much about it from my students who knew someone who accidentally overdosed, or that student who came in to meet with me and literally fell asleep talking to me. Like, seriously? I mean, over time, I realized what was happening. But wow. But It appears that many people are substituting medical CBD instead of opiates. That's great news. A University of Michigan research team investigated 878 people with fibromyalgia who use CBD. About 53% of them in that study substituted CBD for opioids and 23% for benzodiazepines. 94% of those who substituted resulted in stopped or reduced use of medications. Most stated it was because of having fewer side effects. So I'll get into more of this in another video if you're interested. But what do you think about this? Would you substitute your pain medication, if you're on pain medication, for CBD? Are you already doing that? How do you choose your CBD? I would love to know that. Does your doctor prescribe CBD as a real treatment? I'd really like to know. So I hope you learned something. I send you gentle hugs and support. Love you. And about half of the CBD, according to it appears that CBD oil may alleviate symptoms of it may relieve pain. People who took fibropacin per kilogram, a CBD product may be in the form of a CD. Everyone knows about the opioid. If you're on pain medication, lips are so chapped.